Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Classification of the vasculitis. Classifying the vasculitis based on the pathogenesis. So to begin with, the first is the direct infection. The direct infection, it can be bacterial, rickettsial, fungal, viral or the spirochetes. And then we move on to the immunological. So immunological, it can be divided into the immune complex. So immune complex, it can be the HSV, that is a Henoch-Schönlein purpura, the systemic lupus erythematosus, the rheumatoid arthritis, serum sickness. So it can include the serum sickness as well, the rheumatoid arthritis, the drugs such as the penicillin, the cryoglobin vasculitis and the polyarthritis nodosa. Next is the ANCA involved mediated. This includes the vaginogranulomatosis, the Church-Strauss syndrome, as well as the microscopic polyangiitis. Then comes the directed antibody mediated. This involves the Goodpasture syndrome and also the Kawasaki disease. Kawasaki disease is the anti-endothelial antibodies. Then is the cell mediated. Cell mediated means it is organ rejection as well as the inflammatory bowel disease and the giant cell arthritis. Now other miscellaneous diseases include the Takayasu arthritis. To learn and grow daily like this, please do subscribe.